All right, welcome today. So we are pleased to have Dr. Alice Silbergleit. She is the director of the speech pathology at Henry Ford Hospital, and she is one of our key players in the speech therapy and post-COVID-19 neurological complications. So welcome, Dr. Silbergleit.
And thank you very much.
Thank you. So can you tell us about your journey in COVID-19? How did you start thinking about COVID-19 and speech pathology?
Well, in speech pathology, we do work with language and cognitive disorders from a variety of reasons: head injury, trauma, surgery. And so we've been doing cognitive communication therapy for decades. And then we started to see the brain fog problems with our COVID-19 patients, particularly our hospital staff who had COVID-19, as well as patients in the community who started to go back to their neurologist and complain about brain fog, complain about decreased attention, complain about difficulty organizing their lives. And these are things that we would work on daily in cognitive communication therapy. So we started to be part of the team, of which you and I are part of, this multidisciplinary team, to make sure we see those patients and get them in therapy as soon as possible so they start to have control over their lives again.
That's really, really crucial. And I thank you so much for being part of our team. So me as a neurologist, I evaluate patients, and then definitely my first step is to send them to you for a complete evaluation. So what would you do when you evaluate patients with speech pathology? So like when I send a patient to you, what the patient is expected to have?
Well, that will depend on their diagnosis. But typically the first thing we do always is an oral motor exam and a facial exam. We like to look for symmetry. We like to look for tongue strength. We listen to how they sound and make sure their speech is clear, so their articulation is clear, that they don't have a dysarthria, one of the many 5 different dysarthrias someone can have. So we always screen for that. And then
what is dysarthria?
So dysarthria is a motor speech problem commonly thought of as distorted articulation. Mm-hmm. It could be a low vocal volume. It could be repetition of words in a distorted manner. It can be too much air coming out the nose, so someone might sound hypernasal. It could be a tightness to the voice. So if someone has what we would call a spastic dysarthria, they would have a very tight vocal quality and distorted articulation. If someone has a damage to their cerebellum, they would have what we call an ataxic dysarthria. So they may sound drunk. And so the speech would not be clear. It would not be even. The speech might be interrupted and variable. And so there are a variety of speech patterns that we would discern, diagnose, and then treat through what we would call speech intervention to get speech clarity and to make sure prosody and rate of speech are such that people can understand someone. Someone with Parkinson's disease has a very low vocal volume. We work on getting that volume louder so that people can hear them. Because when people have a hard time understanding someone, the person with the speech disorder typically shies away from communication and can become isolated. So we try to help them to avoid that as much as possible, to maintain social communication, practice their speech, and make sure they're heard and can participate in conversations.
And when I refer a patient to you, what are the package of evaluation that you would do when the patient hits your clinic?
Well, if it's a language problem, let's say they had a stroke in the language area of their brain, we would give them a variety of tests, such as the Boston naming test, which is a very common standardized naming test, because frequently naming difficulty is part of stroke. And we've also noted in our post-COVID patients that many of them have trouble naming or thinking of a word that they want to say. We would also test reading comprehension, auditory comprehension, verbal expression. Mm-hmm. How is their vocabulary? Are they saying words that don't make any sense? or are they saying words that make sense? Are they substituting words? Are they substituting sounds within words so that instead of saying chair, perhaps it came out as care or pair, but what they meant to say was chair. So we would assess all that first, see where the problems lie. If someone has primarily a cognitive communication problem, perhaps they're distracted. We would test their recall. We would test their memory. We might read a paragraph to them and ask them to read it or say back to us everything they remember from that paragraph. We might test their attention to visual spatial cues. We might test how well they can draw a clock. Believe it or not, that clock drawing test is crucial. It tells us a lot about how a patient is thinking, how they are organizing their brain. If someone is able to recognize perhaps that they drew a clock kind of strange, we like the fact that they can recognize it, because if someone understands and sees their problem, we can then work with them on strategies to improve that problem. If someone can't tell that they have a problem, that's a little harder. We might have to get a lot of family involvement and perhaps videotape a patient or audio tape a patient and play it back for them, or show them what they did compared to what should have been done for them to get the hang of, oh, there's a difference there. I'm not really where I was before. So there's a lot that goes into it. Once we see what the problem is, we then key in on our treatment. Where are the areas that the patient had the most difficulty? What are they doing now that is different than what they did before? Let's say they're working and they were quick and they could, manage a meeting, and all of a sudden they can't manage a meeting. They can't remember what they're supposed to present at the meeting. People are losing interest when they're at the podium trying to manage a meeting. So we would key in on ways to help that person focus. One of the things we found is that in order to compensate for memory problems, our patients are using a lot of Post-it notes. So they might have Post-it notes all over their house, or different whiteboards. I had a patient recently who said she writes everything on a whiteboard, and it's too confusing.
Yeah. So let's talk, right? Like, and now, like, you done have a wonderful evaluation, comprehensive. You tested every single aspect of their memory dysfunction, and especially focus on the complaint that they have, and then you have a plan for them for treatment. So let's talk about the cognitive rehabilitation program. Like, what do you do for that? So cognitive rehabilitation, how do you kind of manage that from diagnosis until treatment?
Sure. Well, one of my favorite things is to use a notebook like this and have patients write down their to-do list. And you can see here that I covered up everything except the one priority task that I have to do. And I want you to know, I actually learned this from a patient yesterday. Nice. I had her write a list, pardon me. So I had her write a list and put check marks when they were done. She went a step further and she blocked everything but the priority that she had to get done. Once she got that priority done, she put a check mark in the box and she knew that was done. She also set her timer on her phone so that if she got distracted and the timer went off, it reminded her, oh, wait, I haven't finished that task. So I thought that was a very good strategy to do. I have some patients who can use the calendars in their phones very well. However, sometimes they forget. And recent research shows that handwriting down a task reinforces memory better than texting or typing it into your phone. So I highly encourage patients to make a to-do list and prioritize it. So your top priorities are on the top, and then perhaps, buying snacks for the soccer game may not be as much of a priority as completing an employee's performance evaluation. So the soccer game would be on the bottom, and the work responsibility would be on top in this case. I also highly recommend keeping everything in one place. If you have a calendar that you have everything on, perfect.
Yeah.
But to have a calendar and Post-it notes is too confusing. So we need to focus in. The other problem is medication. A lot of patients forget to take their medication, especially our post-COVID patients. What I've heard is that patients will set an alarm and then go get water to take their medication, and then they have forgotten to take their medication while they're getting their water because they're distracted by cleaning up the kitchen. So one of the things that I've been recommending to patients is if you have an Alexa in your house, program Alexa or any home reminder that it's time to take your medication, and keep your medication right next to the Alexa with a bottle of water. So that as soon as it goes off, you take your medication and you're done. The other reminders that are very helpful are and you can do this in your notebook or your phone if you are used to using a phone, is if you have a meeting in 2 days that you have to prepare for, you put that meeting in your phone for 2 to 3 days before the actual meeting. So it reminds you to prepare for that meeting. It's always in your daily task until you actually get to that meeting. So those are things that are very good reminders. And the other thing I would highly recommend to my patients is to complete one task before you move on to the next, so that you have a sense of accomplishment and the task gets done before instead of starting many different tasks. The other thing is, let's say you're in a meeting, let's say you're in a parent-teacher conference, you want to have that notebook with you at all times, the one that we talked about, and you take notes. And they're not complete notes. They're just little, short phrases. Sometimes just a bullet point isn't enough to actually remember what it meant when you look at it later. So sometimes you do have to write down 2 or 3 words to remind you. And then you can go back to that later and remind yourself of the conversation and what's important to do. So taking notes is really important. And it also helps you keep a diary. So that night you can go back and look at what you did during the day, and it helps remind you. As some examples.
Yeah. So when I think, that's like a great point. And I see my patients benefit so much from taking notes. And I have them like put in the things that they're forgetting, or things that they have to do, or the complaints. And usually the first few weeks of evaluation, the list is long. The things that are suffering from, they are long, and then it gets smaller and shorter with time. And that's nice to have a track of like how the process went from not comprehending everything to improving and so on. So I really love your points of like keeping notes, keeping yourself organized. It's kind of like you have auxiliary things to help you to manage, so that you take a few things off of the brain, so that the brain will recover and improve with time. And like I really have like good success with those strategies. When I said my patients for evaluation, they always like this strategies and these points that you always give them. Excellent. Do you have any books that you recommend for patients to review or study about this?
I really haven't. And everyone is so different that I'm a little hesitant to recommend something that I haven't really read very much. I have read a couple books. There are lots of self-help books out there on memory.
Yeah.
What we have found over the many, many years is that the best way to manage a memory problem is compensation. We don't drill. We don't use drills for memory because life is so diverse. Conversations are so diverse. You can't predict when you're going to have a memory problem in a variety of situations. So if you have something to rely on, like a notebook or your phone to put information in, you'll always have that, and you can, and whether you need it or not.
Yeah.
So it's hard to, I'm sorry, I really can't recommend like a great book to help memory.
Sure.
I think because everyone's situation is so individual, it's hard to do that.
Yeah, and you have interesting patient stories that you had coming through your clinic and getting better with treatment and evaluation.
Yes, I actually had a recent, very nice success story, and part of it goes along with confidence building.
Mm-hmm.
When you're able to manage your life, you feel better about yourself. And so I had a patient recently in the healthcare field who was very distressed at her first evaluation because she had a large responsibility in her job and felt that she couldn't manage it. She couldn't do things as quickly as possible. She was forgetting things. She had a wonderful supervisor who understood. However, she came back actually recently so organized and moving through her days so much better, and just felt so much more in control. And she'll be very successful now in her job. And she is still in therapy, working on a variety of things, but she is staying in her job and she's managing her job very well. So that's always rewarding to hear. And we have many patients like that. Some patients take longer than others. It's just everyone's different, and everyone's job is different, even if it's a job in your house versus a job outside your house. Managing and staying organized is just such a big key to staying in control.
Yeah, that's really good. Like healthcare workers are one of the hardest hit groups because they are the frontline workers, and then lots of them, they had COVID-19 early on, and then they are suffering from that. And I see so many people like that in my clinic who are like doctors, nurses, or any healthcare workers. They are on the front line and they got COVID and they are now suffering, unfortunately. And we're working with them to kind of organize their work better, and we have good success story. So my question is that, yes, so we are at Henry Ford. We built a wonderful center for post-COVID evaluation and treatment, and we have a multidisciplinary team. So what would you say to other people who do not have this fancy setup of neurologists and speech pathologists and other doctors? So if somebody is out there, what would you recommend for them to do to help their memory, and what qualified providers they can see to get that treatment they need and rehabilitation?
Well, I would tell the person to ask their doctor for a speech pathology referral for cognitive therapy. I would get them in as soon as possible so that struggle is just like eliminate, like let's get right to it. And a lot of times people are trying on their own and they haven't really had success, and it just frustrates them and reduces their self-confidence, which doesn't help their ability to improve. So I would first tell a patient to please ask your doctor, your neurologist, for a speech pathology consult, which we are so appreciative of you, Dr. Danoun, because a lot of patients don't know. I do hear from patients, we never thought a speech pathologist could work on this with us. We thought it was just speech and not brain functioning. And so it's really important to do that. And I would recommend that they try some of the suggestions that I just mentioned. However, it's best to have a complete evaluation first to really know where the problem areas are, where the success areas are, so we can capitalize on the success areas to help those problem areas.
Yeah. Excellent. So in summary, that's great. So you recommend that they see a neurologist or their primary doctor and then refer them to the speech pathologist. And to be honest, like speech pathology is a hidden treasure. it's a gold mine. Like, to be honest, like we did not know like how much speech pathology can do. Like we thought, like you said, people thought that speech pathology just treats stutters and aphasias after stroke, but you guys have a whole wide of treatments that are available, and you really shine and rise in the post-COVID-19 brain fog and memory issues. So it's your court now, and we're happy to refer all of our patients to you so that they get better.
Thank you. We have a great team of clinicians who work on this like I do, and we're all very happy to help.
Yeah. And
anyone
last
who can.
question, do you do everything in person, or this can be done virtually?
It can also be done virtually. We're doing both.
Excellent. So
So
I think
definitely
that's
able.
in this day and age of technology and telemedicine, I think it's here to stay. And really, you can sit at your at home and comfort of your house, and then just get that evaluation and treatment online virtually with your provider, and it's all compensated and paid for by the insurance. So I think that's a great resource for everyone to get use of.
Yes,
Well,
definitely.
yeah. Well, any last tips and advices you want to say before we finish?
I would just say to people who are listening to this that have problems to please get help as soon as possible, because you might be surprised that it can really help you instead of trying to manage on your own, and really go ahead and not think, well, this is the way it is, because it's very possible that things can get better with therapy.
Well, excellent. Very, very good advice. And Dr. Silbergleit, it was a pleasure meeting you and talking to you and sharing your wide experience with this. And I hope everyone enjoy this interview and benefit from that. Thank you so much and have a good day.
Thank you. You too.
Well, that was wonderful.
Oh, fabulous. Thank you
Yeah.
so much, Omar. That was so interesting.
Yeah, very good. Very good. Thank you.
Thank you for all of your support. We appreciate it so much. And you know what? More than that, the patients appreciate it, because
Excellent.
we don't know if we're not seeing them. And
Right.
it's just heartbreaking to see people who have tried, have been going through things on their own for months. And we're just happy to get them in clinic and get them going. And